Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. The Central Board of Secondary Education has declared the NEET UG exam results for MBBS admissions. The cutoff has dropped from 131 to 119 marks this year. 7,14,562 candidates have qualified, and a girl from Bihar has topped the exam with 691 marks out of 720. The exam was conducted for over 66,000 MBBS BDS seats across the country. The Health Ministry has barred 82 medical colleges to admit students for the academic session 2018-19 on MCI's recommendation. The barred colleges include the 70 private and 12 government colleges. The decision comes after various deficiencies were observed, such as inadequate infrastructure, faculty and resources during MCI inspection. The Supreme Court has agreed to examine the validity of upper age limit for NEET and issued notice to MCI and CBSE seeking response. The response comes after aspirants challenged the Delhi High Court's judgment dismissing the plea against upper age of 25 and 30 years for general and reserved categories respectively. FDA recently approved pegfilgrastim JMDB as the first biosimilar to pegfilgrastim, which decreases infection chances during cancer treatment. This approval is based on the review of extensive structural and functional characterization and other clinical safety and effectiveness data. A study has suggested that the test, which analyzes free-floating DNA in blood, would be able to detect early-stage cancer. This study was conducted on blood samples of approximately 1,700 participants. It concluded that more than 54% of the somatic mutations detected in blood samples were derived from white blood cells and not from tumors. The European Medicines Agency has recommended the approval of enotersen for stage 1 or 2 polyneuropathy in adults with hereditary familial amyloid polyneuropathy. Enotersen is also under regulatory review for marketing approval in the United States and Canada. Army is launching a sexual health awareness program to dispel taboos related to sexual medical conditions, which will cover almost 3.5 lakh doctors. Army will also release an e-bulletin on male and female sexual dysfunction and encourage sessions once in 3 months for doctors. A new app called MBlood is now available that aims to connect 1 million of donors with the patients across the country. The app was launched to create the largest online network of blood donors. It is one of the first initiatives in India that aims to ease the families to locate the donors nearby the hospital concerned. ACUG revises new guidelines on postpartum care to reinforce the importance of the 4th trimester. It now recommends that postpartum care should be an ongoing process rather than a single encounter and emphasizes on care within the first 3 weeks of postpartum. The recommendations include developing a plan for postpartum recovery before the birth of the baby. The first visit should include an assessment of physical recoveries like the healing of any scars and tears and a return to normal uterine size. A screening for postpartum depression. Doctor and patient should establish a follow-up plan for any chronic or pregnancy-related medical conditions. Paid parental leave is essential. These recommendations will help prevent many deaths in postpartum women. Kindly share your opinion on this guidance in the comment section below. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!